Hi, I'm Dr. Sharwana Davis with the Georgia Mind Center, and I'm a psychotherapist. And I wanted just to take some time today just to talk about maternal mental health. There were some stats in general about maternal health that were disturbing, so I thought it was worth just spending a little bit of time providing just some general information about how to safeguard your maternal mental health. So let's take a look at some of this information. Before we get started, I just wanted to provide this disclaimer that this presentation is for informational and educational purposes only. It is not intended to be used as legal, medical, or psychological advice. Although I strive to provide accurate general information, the information presented here is not a substitute for a professional advice, and you should not rely solely on this information. Please consult with a licensed professional before making a psychiatric, psychological, professional, legal, instructional, and financial or tax related decisions. So, this is the statistic here that was incredibly disturbing. It stated that 1 in 10 Georgians, so I'm currently residing in the state of Georgia, and the stats were specific to Georgia, but I suspect that this could be true in some other states as well. But a recent survey revealed that 1 in 10 Georgians know someone who has died from pregnancy related complications. And Black women are 3 times more likely to die from pregnancy related complications than white women. So there's a lot of disparity there just in terms of maternal mental health, even within this state. And that could be true in some other states as well. So it begs the attention that we're dedicating to it today. From a maternal mental health perspective, there was also some additional information that was also equally worth paying attention to. So, this study, American Hospital Association, cited this information. It stated that maternal mental health conditions such as depression, anxiety, substance use disorder are the most prominent complications of pregnancy, childbirth, or postpartum, affecting 1 in 5 women. So, can you imagine that if you lined up 5 women who had given birth in a room, at least one of those women would be impacted from a mental health perspective. So it is definitely something that we want to continue to pay close attention to. So I just want to talk with you just about some maternal mental health, what it is, challenges faced by mothers, some common maternal mental health disorders, some signs and symptoms and risk factors as well. So, what is maternal mental health? Well, maternal mental health focuses on women during pregnancy, childbirth, and postpartum. So, maternal mental health doesn't start just when a woman gives birth, it actually starts from the minute she is pregnant. So, it's really important to guard that woman's mental health from the pregnancy through the childbirth to after childbirth, particularly during that first year after childbirth. It's really important to monitor and provide support. Here are some stressors faced by mothers. So, stressors include emotional, physical, and social challenges. Right? It is incredibly different if you are a first time mom. It can be quite shocking, right? The huge responsibility that you now have as caregiver. And for many women, they're the primary caregiver of their children. There are societal expectations about what a perfect mother is. And so people want to fit that mold of what a perfect mom is, which we know there is no such thing as a perfect mom, but there are these societal pressures that women experience about what to do and what not to do when it comes to motherhood. And then, of course, there are hormonal changes both during pregnancy and after that impacts some of the stressors related to women's mental health. Some of the common mental health disorders include baby blues. So, this typically shows up within the first 2 to 3 days after childbirth, and it can last up to 2 weeks. So we commonly think of this as baby blues. There is postpartum depression, which lasts longer, and often the symptoms are more intense. And then, probably the most severe is postpartum psychosis. And in some cases, this can be a lifelong struggle for women after they give birth. And this is really people who've given birth, they enter psychosis. So they have psychotic features. So they may hear voices, they may have hallucinations. There's all types of things that happen during that postpartum psychosis. So it's really important for all of these types of mental health disorders that women are seeking help. But in particularly, the postpartum psychosis can be really, really scary, and it can be lethal in some cases. So it's really, really important that women are getting the support that they need, even at the baby blue stage, right? It's important that they're getting the support from their healthcare providers and their support system. And then, of course, there's postpartum anxiety, where there may be excessive worry that takes place even before the baby arrives. There, it could be worry, and the woman can be excessively anxious during that period, both during pregnancy and even afterwards. Signs and symptoms to look out for: behavioral changes, so appetite, sleep disturbance, withdrawal, irritability. There can be some emotional indicators such as mood swings, some persistent sadness, feelings of worthlessness or excessive worry. Physical symptoms: weight gain or loss, panic attack, digestive issues, fatigue, and a whole lot of other things. So, long story short here, if you are a woman who's given birth and you're going through a period where you just don't feel like yourself, it is imperative that you speak with your healthcare provider, and share that so that you can get the support that you need, both from overall physical health and well-being, and of course, mental health as well. Risk factors: people who have a history of mental health conditions, that those conditions can be exacerbated during the pregnancy period and after. When there's a lack of support system, it is daunting when you think about caring for and growing a human being, right? And so when there's not a support system in place, it can be quite stressful for the woman who's having this experience. So a lack of support system can really be triggering. It can cause all kinds of difficulty for both mother and baby. Financial stress: it's very difficult when you think about the cost that it takes to actually give birth and then to rear a child. It is extremely stressful. And then sometimes people have traumatic birth experiences. So this is when people are giving birth. It's not like the movies in some cases. It can be traumatizing, particularly when there's a loss associated with that birthing experience. So these are all risk factors. Of course, your mental health as a mother impacts the mental health and well-being, the physical well-being and mental health of children, right? It can have effects on bonding and attachment. We know that it is crucial during the first years of life that a child is bonded to their primary caregivers. And when a mother is experiencing mental health conditions, for many, it's difficult sometimes just to get out of bed. And so they just don't have the energy to devote to some of the caregiving roles. So it can really have an impact if the mental health condition is left untreated. Of course, that can have a long-term impact on the child's development, their cognitive and emotional and social development. And it's really important to have early intervention. There is attachment and bonding therapy. There's so many ways to make sure that any impacts that the mother is feeling, that her baby is not having to have long-term effects from that. Here are some ways that women can be supported: therapy and counseling, right? That's really critical so that they know that they're not alone. They can get coping skills and ways to improve their overall quality of life and well being. Have a good psychiatrist, right? It's important that if medication is needed, that they're getting prescribed from a psychiatrist the proper medication and care. Support groups. A part of a support system is knowing that you're not alone and you're not the only one having this experience. So, as often as you can tap into other people, other mothers, if you're first time mom, tapping into first time moms is critical, and that will help normalize your experience as well. And then just overall meditation, self care practices is critical. Here's just some resources for support that you may want to take a look at. Again, just being able to connect to places that provide research and um, referrals and all sorts of information related to postpartum care is critical. So, hopefully, you found this information helpful and just want to thank you for watching. Feel free, if you enjoyed this information and you want more, feel free to like and subscribe. And look forward to seeing you next time for another topic.